Hi, my name is Dana Davis, and I'm a licensed professional counselor, and I work in outpatient services at Southwest Mental Health Center in San Antonio, Texas. Today I'm going to be talking about ADHD and the classroom. Oftentimes, ADHD kiddos can struggle while they're in the classroom. And so today I'm going to talk a little bit about what's going on in their brain, if they know better and can actually control this, and then maybe some tips for parents and for teachers on how to handle these kiddos if they start having issues in the classroom. First of all, the technical stuff. The ADHD brain. What's going on in there? Doctors know that ADHD is caused by changes in brain chemicals called neurotransmitters. Neurotransmitters help send messages between nerve cells in the brain. Dopamine is an example of a neurotransmitter, and low amounts of dopamine will cause symptoms of ADHD to appear. ADHD interferes with the capacity to regulate activity level, inhibit behaviors, and attend to tasks in developmentally appropriate ways. So what that means is maybe a 9-year-old who, of course, is chronologically 9-year-old, academically can attend and do things a 9-year-old can. When it comes to inhibiting behaviors and attending to tasks, they behave at an emotionally, developmentally younger age, more like 7 or 6. ADHD can affect much more than a child's behavior. The disorder can affect their emotions, their academic performance, and their social skills. Again, can sometimes make them look emotionally younger than their chronological age. Children with ADHD often have other problems such as depression, anxiety, oppositional defiant disorder, language disorders, or learning disabilities. So, at school and their school behaviors, don't they know better? Actually, they do know better. When you talk to a child with ADHD and you ask them, now, don't you know that you're not supposed to be out of your seat when I'm talking? Or don't you know that it's not okay to hit somebody? They will answer, yes, I do know that it's not okay to do those things. ADHD kiddos often have a hard time internalizing those rules or ideas and putting them into action. So they can tell you when they're calm that it's not okay to do those things. But in the moment, the thought will go through their head, oh, I need to sharpen my pencil. And they hop up and they go sharpen their pencil. Or they become upset with somebody and the thought goes through their head, I need to hit this person. And instead of stopping and thinking, their impulsive behaviors come out and they hit that person. These children with ADHD also struggle with delayed gratification, which can add to impulsivity. They have problem, oh, I need this now. And so instead of being able to wait, like those of us with more mature emotional or more emotional maturity, instead of being able to wait, they say, I need it now. So they hop up to go get whatever it is at that moment. When in reality, they need to be sitting in their chair and listening to what the teacher is saying or working on a worksheet or what have you. ADHD children often use developmentally inappropriate ways of interacting with the world. For example, they use hitting and pushing when angry instead of expressing themselves verbally. So what we know is that 2 and 3-year-olds with limited verbal skills will hit or push or cry to let people know how they feel because they don't have the verbal capabilities to use their words. Oftentimes we see 7, 8, 9-year-olds doing these same things when we know they have the verbal capability to let us know how they're feeling. So we fuss at them and ask them, why are you doing this? When in reality, if you have a kiddo with ADHD, oftentimes this is really difficult for them to use their words. Oftentimes because of the impulsivity and because they're a bit developmentally behind in the emotional maturity range. So, let's talk about some suggestions of dealing with impulsivity and noncompliance in the classroom. And really, it can be at home as well. The first thing to remember is that children do well if they can, not if they want to. Most children want to do well. They want to please. They want to be praised. They don't want to go to timeout, go to the principal's office. So that is something to remember. Children do well if they can. If they're not doing well, if something is causing them troubles, something is in their way. So Is it the ADHD? Possibly. The ADHD is in their way of making good choices. In the classroom, it's important to have the child that you know is diagnosed with ADHD sit in the front of the room, away from the windows and the hallways. We want to keep them away from distractions as much as possible. So having them sit in the front of the room will keep them from the windows where they can gaze out at what's going on, or the hallways where there's always somebody moving around. ADHD kids often do better if they know what to expect. So if you can post a copy of the day's schedule, whether it's your home schedule or the classroom schedule, so that way they know what to anticipate. They know, okay, I have to sit in my chair and listen to this story until 9:50, and at 9:50 we go to specials. Or I have to work on my homework until 4:30. At 4:30 I can take a break and have a snack. That helps the child to know that it's not an indefinite thing that they have to sit and do their homework or sit and listen to a story. That can be difficult for them. They can see the light at the end of the tunnel by being able to watch the clock. Be aware of auditory and visual distractions which can overstimulate a kiddo. So if you're going to be playing a game, or if they're going to be playing outside, know that these things can possibly overstimulate a child with ADHD. Overstimulation can cause increased impulsivity and other behaviors which can cause problems for them. It's not that we want to keep these children from doing these activities. It's that we want to be aware that this can cause problems, or can potentially cause problems. So we want to help that child plan for it, and as a parent or a teacher, anticipate that this could be an issue and watch for overstimulation and step in a little bit before there could be a problem. Oftentimes ADHD students need to think out loud. They have a problem thinking things through in their head, so they sort of need to talk it out. So if you're giving a test, or if it's a worksheet, also having the child in the front of the room, they might be less apt to distract other kids by reading out loud. Or they can sit in a corner. Sometimes they have the option of going to another classroom so that they can do these things out loud. Have the student think for 10 to 20 seconds before answering a question instead of answering impulsively. We all know, teachers that and parents, that your ADHD child will blurt out answers, blurt out things. So by teaching your child and the student to think for 10 or 20 seconds, count to 10 before you raise your hand or shout out an answer, this can train them to not be so impulsive in that manner. Praise specific behaviors. So while you're doing the questioning about the book you just read, and the ADHD child is raising their hand consistently or stopping to think before they answer a question at home, praise that behavior. Let them know that you noticed that they did it. What that does is it brings it to their attention. They may not even realize that they're using that coping skill. And if you can bring it to their attention, then they realize that they've done it and maybe be able to implement it in other ways later on. As a teacher, you've heard this before, but you want to frequently move around the room. It helps if an ADHD child is getting overstimulated or starting to move around a lot. If you're moving around the room, you can stand next to that child. You can bend down and speak to them quietly about, if they need something to help them be able to focus. Use a kitchen timer. This helps the kiddo with time. Sometimes ADHD children struggle with telling time or monitoring the time. So having a kitchen timer, they can watch and they know exactly how much time they have. Sometimes a kitchen timer makes noise, so there are timers that are quiet that the child can have on their desk or near their desk so that they can kind of watch what's going on. This also helps out at home with timeouts, with homework. This is how long you need to sit here to work on your homework. Set it for 5 or 10 minutes. They work on it and then they get a break. and that you can also time the break as well. Listen to the child. This is something that when I was a school counselor, I heard frequently. They just aren't listening to me. The teachers, they would say the teachers aren't listening. Oftentimes the child can help us understand how to help them better. It may seem like something that's over the top, that may seem out of reach for the classroom or even at home. But if we listen to the child, maybe we can find a compromise between what they want and what we can do, or what they say they need and what we can do to help that child be more successful in the classroom or at home. Provide a safe environment. Provide a safe environment for that child to be able to come and talk to you, whether you're a parent or a teacher. They can let you know, hey, I'm feeling really jumpy today. Can I sit in the back of the room, or can I sit in the beanbag today instead of having to sit upright in my chair? I'm feeling like I need to take a break a little sooner. Can I take a break at 9:30 instead of 9:45, or whatever? We want to provide that safe environment for that child to be able to talk to you. Always treat them with respect. This can be a very difficult thing to do when you're feeling really frustrated with that child who is not listening, who is being oppositional, who is fidgeting and out of their seat. It can be really frustrating as a parent and a teacher, but we always want to treat them with respect, to know that if they have ADHD, this is something that they're working on, and this is something that we can help them with. So we want to be able to treat them with respect so that they can see and learn how to treat us with respect. The only way that we can do these things that we're asking of these children is to show them and give it to them so that they have it to give back to us. And finally, you want to pick your battles. We can fight every battle with an ADHD child. Sit in your chair, put face forward, put both feet on the floor, stay in timeout, clean your room, all of these things. So we want to pick the battles and of the hills that we truly want to die on. What is most important to us as a teacher or a parent that this child does for us? Then we let some of the other things go. Does the child need to have one leg in the chair, sit on his knees in the chair, maybe stand up and not even sit down? Is that something we can tolerate? Can we move their desk to the side? In cleaning their room, it may look very overwhelming, so maybe we need to say, okay, pick up all the toys first, and when you've done that, come back and tell me. Then we go back and we say, okay, it looks like the toys are put away, praise them for that, and then we move on to the next thing. Okay, now it's time to pick up your dirty clothes. So we definitely want to pick our battles and be able to say that we let some things go. Otherwise, we're constantly on that child. We're constantly feeding them negativity, and we want to be able to give them some positive kudos in the meantime. Well, that is my presentation today on ADHD in the classroom, and I guess at home as well. I hope you enjoyed it, and you can take something away from this presentation and use it in your life today, and hopefully make the life of your student, your child, and yourself a little bit easier. Thanks, and good luck.